Hello everyone, greetings of the day. I'm Anuja Purohit from Radiance with You YouTube channel. I'm sure all of you must be keeping good health. Today we are diving into a topic that touches everyone under the sun, literally. We embark on a crucial discussion as we raise awareness about fungal infections and the proactive measures we can take to prevent their spread. Fungal infections might not always be the top of mind when we think about healthcare, but they are certainly not to be underestimated. From athlete's foot to nail fungus to more serious conditions like invasive candidiasis, these infections can wreak havoc on our health and well being if left unchecked. But fear not, we are not just here to talk about the problem, we are here to discuss solutions. From simple prevention techniques to the latest advancements in treatment, we'll be diving deep into strategies for combating fungal infections and safeguarding our health as this is a Fungal Awareness Month. That's why we are thrilled to have Dr. Ashima Chandran from Kasaragod with us today. Welcome, Dr. Ashima Chandran.
Hi. Hi.
Thank you for joining us today. And friends, Dr. Ashima Chandran is an MBBS MD DNB consultant dermatologist, Wintouch Multispeciality Hospital, Kasaragod. She leads with a commitment to excellence and patients' well-being. With an impressive academic background, Dr. Ashima Chandran is an MBBS MD gold medalist. Dr. Ashima Chandran's professional ethos revolves around providing the same level of care she would want for her own family. She understands the profound impact skin conditions can have on mental health and self confidence, also, thus ensuring her patients receive comprehensive and holistic treatment plans tailored to their needs. So, thank you, Dr. Ashima, for joining us today, and let's begin with today's session.
Thank
So,
you.
first of all, what is a fungal infection?
Yeah, fungal infection is something where there are so many types of fungus that the common is the dermatophytosis. So that fungus infects your skin, leading to certain kinds of symptoms. So you have to be careful where there can be some early signs and symptoms of fungal infection, like there is red scaly rashes that is itching all the time, giving you some sort of discomfort, and the
Hmm.
symptoms you have depends on what area it is infected. Okay, so if your foot is infected, there can be a bad odor, and it commonly infect the areas which is less breathable, like armpit, the groin areas. So there and all you can see some kind of whitish discoloration, what we call as maceration, and in other
Hmm.
areas you can see some kind of scaling, flaking of the skin and all. It can affect anywhere, like your nails, your scalp in children commonly. So the nail, if it is affected, there can be some sort of the blackish discoloration, whitish discoloration. So it can affect anywhere. So this fungus is everywhere, and it can infect anybody and everywhere. Okay.
So, what are the most common types of fungal infections that people catch and they also should be aware of?
So as I told you, like it can infect any part of the body. So depending on the site, we call it different names. So if it is getting affected over our body surface anywhere, like our limbs or our abdomen, we call it as a tinea corporis. And that tinea is a common term, what we call the fungal infection, that is dermatophytosis. In children, the scalp is one of the commonest area to get involved. Then we call it as tinea capitis. The face, we call it tinea fasciae, and this feet, what we call athlete's feet, tinea pedis. Nails can be infected, onychomycosis, tinea manum. There are so many names, and it can affect any part of the body. So
Yeah. So, how are the fungal infections graded? I mean, according to the site or according to their severity, how do you grade the fungal infections that you see most commonly in your patients?
that grading is based on the extent. Like if it is a very limited, like only a single plaque is there, a single a body surface area is involved. It is like there is nothing like mild, moderate, severe. We call it like limited or extensive. If many of the body surface area is involved, multiple sites like our nails are involved, face is involved, body is involved, scalp is involved, we call it as an extensive tinea. If it is limited, like only one part of the body, like as I told you, if only nails are involved or only body folds are involved, we call it as a limited tinea. So that's how we grade. There is no such proper grading, but we clinically we grade the disease like this.
Right. And how do fungal infection typically spread?
Usually it spreads from one part of the body to other part by like scratching, because while scratching the
Mhm.
nail, the fungal elements get transferred to the part between our nails. And when we scratch the other part of the body with the same finger, there is the transportation of the fungus from one area to other. That's how commonly it spreads from in the same person from one body surface area to other. And from person to person it spreads by sharing the toiletries, soaps, towels, shoes, and the people who are using public pools or public showers. If we are going barefooted, that time there can be some fungal elements on the floor. So if we have some kind of cracks and all, there is high possibility that you may get fungal infection for your feet as well. And there is if the people are so much sweating, like if you're doing workout or athletes and all, those who are sweating a lot, there is high chance that you may get fungal infection, especially over the body folds. So commonly by sharing the items and by scratching one area to other area, it is getting spread from one person to other, as well as in the same person from one body side to other area.
Right. So, what are the common risk factors associated with this fungal infection spread?
Okay. Some people are more prone for getting fungal infection, like people with a bad immunity. Those who don't have a
Hmm.
good immunity, I should say, like people who are diabetic, their blood sugars will be more. So their immunity will be little bit hampered. So they can get fungal infection more than other individuals. Sorry. So and in the people who are taking any immunosuppressive drugs, and people who are using like who had any organ transplantation, so who are on cancer chemotherapy, children's and elderly individuals, these people will have a little bit lesser immunity. So fungal infection is more common in people with less immunity. So these are individuals who are at higher risk than normal individual to get a fungal infection.
So, are there any factors related to environment or gender or also some hormonal changes? Can these factors lead to fungal infection?
Environment, of course, yes. When the climate is a lot of humid as well as wet, there is less chance that the clothes may get dry. Like in here it is raining now, so there is less chance that our clothes may dry some these times. So that climate and the humidity, when we are sweating a lot, so these climate in tropical areas, the fungal infection is more common than a dry climate. And the hormonal fluctuation, yes, people who have attained menopause and all are bit higher side on getting fungal infection rather than the menstruating woman. uh, the rest Other than these, there are less chances.
Right. Are there any specific populations that are more susceptible to fungal infection? And if so, why?
Population, I would say like what I have told you, like elderly individuals as well as children are more prone for getting fungal infection, and those who have any immunosuppressive disorders, like immune deficiency disorders, these are at more chance of getting fungal infection rather than other population.
So, what are effective prevention methods one can take to reduce the risk of developing fungal infection in any case?
Yeah, you have to be a bit more careful these times because you have to keep your, like as I have told you, some sites are more prone for getting infection, like your body folds, like axilla, the groin. You have to bath twice daily, and you have to keep the area so dry so that when there is more, the surface is more wet, you can have more fungal infection. And you have to use a dusting powder, which are OTC. Some you can get some dusting powders over the OTC, so you can use it twice daily. Make sure all the web spaces, I would say, so you can use it twice daily. And you have to try to dry your clothes in the sunlight. If not, you should dry it under fan, and you have to iron your dress before you wear. And you shouldn't scratch though. If at all you're having you have already developed fungal infection, you should not scratch those lesions, so that by scratching, as I told you, it will there is chance of spreading from one area to other. And one more tip you can do is, if at all you're having infection, you have to apply whatever ointments your dermatologist is prescribing 2 centimeter around the lesion, so that the chance of spreading infection to surrounding areas will be less. And you shouldn't try too much home remedies. You have to consult. If at all it is not decreasing with some OTC medication, you have to consult at the earliest, because initially if you take treatment, the duration of treatment will be less, and you can get cured within a short span of time. And if you're getting it delayed, there is more chance that your fungus may get resistant, and you have to take the treatment for a longer duration. And you shouldn't wear occlusive footwear during this climate. You have to use any breathable clothes, like loose cotton dresses you have to use. And you should always wear a footwear when you are using any public toilets or public shower or public pools and all. So these are some preventive measures you can take.
We sometimes see that acne, which are caused by infection or bacteria, that lead to scarring. So, frequent scratching of the infection site in fungal infection, can it also lead to scarring?
Not much of a scarring like what you see in acne. You can have a post-inflammatory hyperpigmentation, what we call. You can see there is a blackish discoloration over the area where you had fungal infection. That is because of that inflammation happening as a part of the fungal infection. The scarring per se is less common with whatever fungal infection we see clinically. There are other type of fungal infection, for example, Mejochis granuloma and all. That is one other type of fungal infection. In that case, only what the scarring we can see as we see in acne and all. The other in other condition, there can only be a blackish discoloration over the areas you got the fungal infection.
Can fungal infection or can fungus be the reason for developing acne?
It's a tricky question actually. Fungus cannot be the direct reason for acne. For acne, the pathogenesis, there is one bacterium actually, Propionibacterium acne. It can that is the actual pathogen for in the pathogenesis of acne. Fungus per se can't cause acne. Yeah.
Okay. How is fungal infection different from bacterial infection that we see on skin?
In bacterial infection, what like common bacterial infection, what we see clinically is like a boils, a pharyngeal, carbuncle, what we call. You can see pus pointing, you can see a lot of redness, inflammation, pain will be there. But in fungal infection cases, clinically pain will be absent. There is more of itching rather than pain in fungal infection. And pustules, like pus per se, it is less common in fungal infection. There are fungal infections with pustules, but it is not common to see pustules in fungal infection. There is more of scaling. You can see a lot of flaking in your skin and redness. But in cases of bacterial infection, there is more of pain and pustules. That is one way you can differentiate between a bacterial infection and a fungal infection of the skin.
Right. Are there any certain environments or are there any certain activities that increase the likelihood of contacting a fungal infection?
Yeah, as I told you, whatever activities which make you sweat more, there is a chance you may get more. The chances of getting fungal infection is more than normal individuals. Like if you are doing a workout, if you are athlete, and if you are if you are in a hot, humid climate, or if your occupation revolves around sweating a lot, in these cases, there is a more chance you may land with fungal infection. And like in parlor, in beauty parlor and all, who are in contact with clients having fungal infection, and if you are sharing the nail clippers and all, there is a chance that you may get fungal infection.
You talked about beauty parlor procedures and everything. So some people are in profession that that they may have to apply makeup every day, or people love to apply makeup every day in their day to day lives. Is there any chance that they may catch fungal infection more frequently than people having normal skin or people who are not using makeup?
Per se, makeup can't cause fungal infection unless you share your brushes or any blenders and all. Like in beauty parlor, most common we see there is sharing of items without proper cleaning. So in that condition, if one of the client had fungal infection over their face, and if they are using the same brush and all to another person, there is chance that they may get, because there is transfer of fungal elements from one client's face to other. Per se, makeup items won't cause it. Only the sharing of the uh, toiletries can cause fungal infection.
Right. Uh, During humid environment or during gymming activities or people who are sweating a lot, they are prone to catch fungal infection. So, how do you see importance of proper maintaining proper hygiene to prevent fungal infection? So, maintaining proper hygiene, how much is that important to prevent fungal infection other than treatment also?
Because as I told you, those who are having occupation with more likelihood of sweating, I would suggest them to bath at least twice daily, so that all the
Hmm.
sweat will get washed off, and proper using of dusting powder is necessary for them, so that at least they while using the dusting powder, those areas will be mostly dry, so the chances of fungal infection will be less. And they have to use any cleanser or soap at least one time when they bath. Other time it's fine if they don't use also. And they have to dry their cloth properly, and they should use a very dry ironed innerwear also. So these things are very important, so that they can prevent a lot of these fungal infection if they follow these hygiene measures regularly. And those whose occupation mandates so much of sitting, they have to change posture at least once in 2 hours, so that that sweat will get absorbed, rather than if they are sitting the whole day.
Okay. There are some antifungal soaps or antifungal body washes available in the market. How are they important, or what's the role of that in maintaining day-to-day hygiene to prevent fungal infection? Or once the person is having mild fungal infection, to what extent these products can help them?
These products, of course, they will help them, like whatever OTC, ketoconazole, clotrimazole, terbinafine, all kinds of OTC products they can use in the initial period. I would say to prevent it. But once you have started getting rashes, I would say to consult their dermatologist, because There are, I told you, the fungal resistance is so high these days. Rather than experimenting with the OTC drugs, they can initially consult directly with their dermatologist so that the treatment duration will be very less. The ketoconazole soap, as I told you, it can prevent the infection. Clotrimazole, ketoconazole, all these can prevent the infection to certain extent. So the other thing is you can use those soaps and body washes for the areas which are more prone to get fungal infection, like the axilla and the groin and the hands and feet
Hmm.
as well. I won't suggest them to use it very liberally over the body, because there is chance of dryness with this ketoconazole soap and body wash. So those who are having already dry skin, their dry skin condition can get exacerbated with these ketoconazole products. So be careful as well. And if you have any of the symptoms, at the earliest you have to consult the dermatologist.
Many people have this practice of having over the counter medicines for every small problem they have. And we have seen that during bacterial infection, if you take improper medicines or wrong medicines, people have the tendency to develop resistance. I mean, the bacteria have the tendency to develop resistance against those medicines. Fungal infection and antifungal drugs can also cause such resistance if taken wrongly or if taken in wrong dosage.
Yeah, that is one of the major problems what we are facing today. It's like same like antibiotic resistance, there is something called as antifungal resistance. So because people are using it like without consulting, they are directly taking the medications now. So what happens is the fungus which was responding to like very simple antifungal medication is now not responding to the same medication again. And when people are using it for a limited period of days, like 10 days or 2 weeks, as soon as they once they may be symptom free and they will stop the medication, you shouldn't do that. You
Right.
have to use it a specific period of time, because the last fungus also should go away from your skin. So whatever fungus is left after you, once you stop it suddenly, so what happens is whatever fungus is left in your skin, that will become resistant to the antifungal they were already using. So what happens the next time when they get the infection, that fungus is mutated so that it is not responding to the same medication they were using previously. So one shouldn't do such experiments. They should always see the dermatologist and they should follow their advice, and you have to use it for the specific period of time. Then only it will that fungal antifungal resistance won't happen. And what is the problem? What the problem is, if one get a resistant fungus, your fungal infection is going to stay with you for a longer period of time, so that your quality of life will be reduced. So you should use
Right.
the initially only you should consult. When it is a very small infection only you should consult, and you have to take the treatment for the correct duration, so that will decrease the
Right.
likelihood of the resistance.
Right. We have some questions from our viewers also. Mithali
Sure.
Sharma is asking, how does candida cause infection?
Candida is one of the like, as I told you, there are two types of fungus. One is dermatophytosis and one is candida. Candida is the
Hmm.
pathogenesis and all are same. Like whatever I told you regarding what all things you should be careful with fungus. The same holds to candida as well. You shouldn't like immerse your hand and feet for a long time in water and all. Candida mostly infect your nails compared to your other parts of the body. It is more it loves more the nails rather. And there are body folds as well, candidiasis, oral candidiasis, fold candidiasis, nail candidiasis are there. But the preventive measures are same for both. You have to keep all the areas dry.
Right. One more question is from Deepak Saxena. How can I treat a fungal nail infection?
Yeah, fungal nail infection, as I told you, there are some preventive measures. You shouldn't share the nail clippers. You have to follow the nail hygiene. And if at all you are having like the common symptoms will be like discoloration, like white discoloration, black discoloration, and there can be brittleness of the nail. There are these are some of the yellow discoloration. These are some of the common symptoms, and if at all you are having these things, you have to confirm that it is a fungal infection with your dermatologist. They may do a test where your nail clippings will be taken, and there is a potassium hydroxide mount can be done to confirm the signs of fungal infection. And once it is confirmed, they may give you like antifungal tablets, and there is something called nail lacquers and ointments as well. You have to apply for the specific duration of time, and you have to maintain a dry your nail should be dry. You shouldn't immerse your hands and feet too much into water, and you have to you dry your socks and shoes as well. You can use a dusting powder inside your socks before wearing it. These are some of the preventive measures you can do it for a nail fungal infection.
Okay. Palkesh Mehra is asking, what is a systemic fungal infection?
Systemic fungal infection, there is less chance that normal population can get systemic fungal infection. It is more common in, as I told you, like whose immunity is very less, like people who are taking immunosuppressive drugs, and organ transplant individuals, diabetic individuals, and all. So, mucormycosis, systemic candidiasis. These are some of the systemic fungal invasive aspergillosis. These are the systemic fungal infection which are very severe and fatal as well. So, but normal people shouldn't get tense so much regarding systemic fungal infection. The chances are very less. So, if at all you have to seek medical advice very fast, because this can be dangerous.
Right. One more question is from Aditi Srivastava. She is asking, how can recurrent fungal infections be prevented?
As I told you, recurrent fungal infection, first step of prevention is take the treatment at the earliest. So, with when you take treatment early, there is less chance of antifungal resistance and recurrence. And follow whatever the preventive advices the dermatologist had given you, and like stop sharing your personal items with those who have a fungal infection in the family. And if at all a single person is infected with fungus, you have to be careful that there is high chance that other people can also get infected by, even if you wash your clothes together, there is high chance. So if at all you take all these preventive measures, if you have taken the treatment very early, and you if you're following all the hygiene measures, there is less chance you may get a recurrent fungal infection.
Right. Are there any dietary or lifestyle changes that can help boost the body's immune system to fight for fungal infections in a better way?
Yeah, in diet you can include more of iron rich, calcium rich, vitamin D3 rich, and vegetables, fruits as well. So these can boost your immunity. Of course, zinc as well. So these can boost your immunity, and all the personal hygiene measures, as I have advised you: bath twice daily, wear breathable clothes, dry your clothes under sunlight, of always iron your clothes, use an antifungal dusting powder. So all these lifestyle changes, and all these, like I told you, to include all minerals in your diet, this can, and always maintain a good glycemic control. You are not diabetic, you are doing your regular exercise and all, there is a chance that you will have a good immunity to fight the fungal infection.
Are there any such conditions like diabetes or hypertension that people who are having those conditions, which are they are more prone to develop fungal infection?
Yeah, not hypertension, diabetes, yes, because diabetes is like a condition with less immunity, so people won't have as much immunity as the normal population. So, diabetic individuals individuals, they should maintain their glucose under control, like their blood sugars should be very much controlled. If it is uncontrolled, there is a high chance they may get infection more faster than the normal people. Hypertension per se, there are no much chances, it's like a normal population only, but diabetic individuals should be careful.
So any condition that can suppress our immunity, those conditions can lead to fungal infection in individuals. This is what I understood.
Yeah, like I told
So,
you, those which suppress our immunity.
right. So, one question is from our viewer Sonia. She's asking, what role does the immune system play in fungal infection?
The what the immune system does is, if one fungus affects our body, the immune system tries to make the fungus to a limited, it is fighting so that the fungus should be there only over one part of the body. So what happens is, if you have a weakened immunity, that immune system is not working for us, so that the fungus will, there is a high chance that the fungus is spreading so fast that it will get spread all to all the other sides of the body, and it can become extensive tinea, as I told you. So our immune system is the one which is trying to keep the fungal infection under check, so that it won't become extensive. So if we have a good immunity, there is high chance that it will get cleared very fast and it won't become extensive.
Okay. One more question is from our viewer. Meenal is asking, can fungal infection be fatal?
Fungal infection of the skin, there is very very low chance that it can be fatal. As I told you, only the systemic fungal infection is the one which is fatal. The whatever we have told you, that cutaneous fungal infections, there is very less chance that it is fatal.
Okay. Right. And this is about fungal infection. How does fungal infection spread or risk factors? We talked all about that. What role do antifungal medications play in both preventing and also treating fungal infection?
As I told you, in treating patients with fungal infection, we will give, depending on the severity, we will give antifungal medication orally as well as topically. So, by combining these, we are trying to clear your fungal infections very fast. So, whatever, and you can use the dusting powder, OTC creams, and sprays which are available, so that it will get limited. So, but don't try to experiment it too much. You should consult if at all it is not, it is not there within your hands.
Okay. Right. Uh, are there any misconceptions or myths surrounding fungal infection that you would like to address?
um, like you shouldn't treat the patients with fungal infection like untouchable. You can, the only thing is you have to be a bit careful not to share your personal products. Other than that, you shouldn't do the those who are having fungal infection like untouchable things. That is one kind of misconception I have seen. Only thing, you have to take treatment fast. Other than that, I haven't come across much misconceptions regarding this fungal infection.
Okay. Can you share any of your experience of treating patients with fungal infection, which is, memorable or special to you or challenging for you?
As I told you, the challenge we face is where the patient comes to us after visiting so many dermatologists with so much of antifungal resistance. We try very hard to find a drug which is not resistant. Such cases are challenging. So, what we do is, we will educate the patient, we will counsel them regarding all that it is like a 50-50. Patient should follow all the counseling measures what we are giving to them, and we have to do our best. And I have come across people who are like, when the patient presented to me, it was like extensive tinea. Literally, like, there is no area in her body was left without fungus. So we
Oh,
we were searching for the reason, and we we came across that she was a cancer patient. That cancer was hidden. So that was the reason which her immunity got weakened. So it's like a sign of systemic disease. We can call it like a sign of systemic disease. So it can be,
Okay.
it is like a signal that you have something else.
Right. So even a small rash on our body, we shouldn't neglect it, and we should treat it as soon as possible. So that is what uh, is the first line of treatment, I guess, in the case of fungal infection.
Yeah.
Yeah. And what steps do you recommend individuals take to advocate for great awareness and prevention of fungal infection in their communities also?
So, if you come across any of the individuals with fungal infection, please try to educate them whatever I have shared with you. And you shouldn't neglect even a small rash, because you may not know if it is a fungal infection or if it is something else. So you have to show your doctor at the earliest.
Thank you so much, Dr. Ashima, for your valuable time. It has been really a very informative session for our viewers, and it is great to hear from you. We really look forward for many such sessions for our viewers in coming time. So thank you so much for taking out time for our session and educating our viewers.
Thank you. Thanks a lot. Thanks for your patient listening.
And thank you, viewers, also for this participation in today's session. Uh, So stay connected to our channel and do not forget to subscribe our channel Radiance with You. We'll see you again with many such sessions in upcoming time. Thank you so much.
Thank you. Thank you. Bye.
Bye.